The health department has confirmed another case of cholera, this time from Pakistan. It's understood that a 24-year-old South African who traveled to Karachi developed cholera symptoms 2 days before returning home.
Officials say during their investigations, none of his close contacts presented any symptoms. Now, this is the country's third imported case. The first two traveled to Malawi. Let's get some clarity on the situation now. Joining us is the Deputy Health Minister, Dr. Sibongiseni Dhlomo. It's great to talk to you. Thanks very much indeed for coming on. What is the significance, Dr. Dhlomo, of this third imported case in South Africa?
Good evening, good morning, ma'am, and good morning to your viewers. Firstly, is to indicate that we have countries around us, and some of them far-flung as Pakistan, that has still got endemic cholera in them. We actually look back and say 10 years ago we probably had this challenge, but we have since outgrown that by provision of safe and clean water for most of our citizens. Yes, there are pockets of areas that are still not as good as like we found in Hammanskraal a few weeks back, but then we really give this actually alert and so that our South Africans can be aware that there is this process that is on. Number two, we are also saying it because if we had actually confirmed in the laboratory and just keep quiet about it, there would be someone who would pick it up and say, but why is this matter not reported? Yes, you are correct. It's a third case after the two cases that we had early in the year, February, from Malawi. This one is imported from Karachi in Pakistan. We are really calling for me and you, all our South Africans, to be alert and really to still focus on our personal hygiene when we prepare food, when we come from the bathroom, and also make sure we really would avoid contamination of our water and food through not washing our hands.
Yeah. The worrying details, insofar as this case is concerned, Dr. Dhlomo, is that the patient already was experiencing these symptoms, the abdominal cramps, vomiting and diarrhea, while still in Pakistan, which we know is cholera endemic, and then traveled to South Africa. You know, at what stage do we start talking about advisories to people who are traveling to particular countries, countries that, like Pakistan, are cholera endemic, and then traveling back to South Africa?
Yeah, like this interview we have with you is part of assisting us to really spread the message. But on arrival of King Shaka Airport, the South African 24-year-old was asked and did mention that I had the diarrhea when I was as I was traveling back. But I treated it with bottled water. I think it has subsided. And they were picking up signs of dehydration. That's why this person was followed up, and a day later was then admitted in one of the Durban hospitals to follow. But this issue was picked up at that space at the arrival on the 16th of July.
Yeah. I understand that his specimen was taken while he was seeking treatment in hospital on the 18th of July. And then cholera was confirmed on the 24th of July, Dr. Dhlomo. Is that quite a long time to come back with a confirmation of cholera?
Yes, ma'am. It is not an overnight process. You take a stool specimen, take it to the laboratory today, get it cultured tonight, and then the next day you start seeing some colony, but you don't see that well. And then on the third day you then take it to the test. So it means you have to culture, put it into a particular medium and prepare that to really grow. Only then that you pick it up, that you take it to the laboratory. So you don't pick up a specimen and get it done within an hour. It takes anything between 2 to 3 days to get that confirmed through the laboratory test that they put you through.
Yeah. The area of Hammanskraal in Tshwane just recently had quite a big cholera outbreak, a number of people dying in that community, Dr. Dhlomo. Given this new now imported case, given what we've seen in the country over the past few months of insofar as cholera is concerned, aside from the advice that we're giving people around hygiene, is there anything different that the department is doing?
We are working collectively with another department called Water and Sanitation. We are expecting, as I've been advised, that the Water Research Commission will be releasing the report today as to actually what is the situation in that area. You would recall that while we had an outbreak of cholera in and around Hammanskraal, Kanana area, there is no source yet that was confirmed and identified. And therefore, it could have been me, you, having been in that area, preparing food in a funeral area, and therefore the food not properly cleaned up, and then it gets to contaminate and people get the cholera there. Because the source, though there has been an announcement by the mayor of the city of Tshwane that they are actually raising that the water is not clean and safe for human consumption from their pipes, and hence they are providing water tankers. But the Vibrio cholera has not been actually found in the water, unclean as it is. It may be other issues. So they will probably be telling us through the Commission's report today as to what actually is the status of the water in and around that area. But the Vibrio cholera has not been identified as yet. It could have been a carrier person like me or you having that, and it contaminates food or water.
Of course, access to clean water is paramount in dealing with an outbreak of this nature as well. Deputy Health Minister Dr. Sibongiseni Dhlomo, let me thank you for your time this morning here on the AM Report.